I'm going to start by washing my hands. I'm going to close the curtain for patient privacy. Hi, my name is Johanna. I'm going to be the nurse practitioner doing your assessment today.
Hi.
We're going to start by going over your vital signs. They were all within defined limits. Also, your BMI, based on the height and weight that we got today, fell under the category 23, which is the healthy category. Okay? Can you tell me why you're here today?
I've been having some neck pain.
Some neck pain. Okay. Can you show me where the neck pain's located?
Yep, it's right about here.
Right about there. Okay. Can you tell me when this pain started?
About 2 months ago.
Okay. And can you describe the pain for me?
An achy pain.
An achy pain. Okay. On a scale of 0 to 10, where would you rate this pain?
It can be up to an 8.
An 8. Okay. Is there anything that makes the pain worse?
Sitting for a long period of time.
Okay. Is there anything that makes the pain better?
I've tried heat and that helps.
Okay. Do you have any other associated symptoms with this neck pain?
No.
No? Okay. So now we're going to move to the assessment part of the exam. I can see that your skin is dry, it's warm and non-tenting. There's no lesions or nodules present. I'm just going to take a glance at your nails. I'm just checking your capillary refill on both hands, which are both less than 3 seconds. Your nail angle is 160 degrees. Okay? So now I'm going to look at your head. I can see that's normal cephalic. I'm going to look at your scalp. I can see that there's no lesions or nodules or edema present. Based on looking at your hair, I can see that it's brown, fine and thin, and it is evenly distributed. Okay, so now I'm going to have you do a couple of things for me, okay? I'm going to have you smile. Awesome. Frown. Puff out your cheeks. Awesome. And close your eyes. Perfect. I'm just going to have you clench your teeth for me. I'm going to feel your muscle right here. Awesome. I'm also going to check your temporal pulses, okay? Okay, I'm just going to grab my cotton ball over here. Just tell me if you can feel this, okay?
Yep. Yep. Yep.
Okay. Does it feel the same on both sides?
Yep.
Awesome. Now I'm just going to go through your lymph nodes, okay? So we have preauricular, postauricular, occipital, tonsillar, postmandibular, postmental, posterior cervical, anterior cervical, subclavicular. Awesome. So now we are going to move to your ears, okay? I'm going to look at the external structures of your ears. I can see that they're in a normal position on your face. I can see that there's no lesions or edema or nodules present. I'm going to check for some tenderness, okay?
Okay.
I'm going to check your pinna, your tragus, and your mastoid process. Any tenderness in any of those places?
No.
Okay. I'm going to do the same thing on the other side.
No.
Nope. Okay. I'm just going to grab my instrument over here. I'm just going to take a peek in your ear, okay?
Okay.
Okay. I can see your cone of light bilaterally. I'm just going to have you scoot up in your chair just a little bit, okay? We're going to do something called the whisper test. So what I'm going to do is I'm going to stand a couple feet behind you. I'm going to whisper 3 letters or numbers in both of your ears, and you're going to repeat them back to me, okay?
A14.
Okay.
CA4.
Perfect. And you can get comfortable back in your seat. I'm just going to grab my tuning fork. So I'm going to do 2 tests with the tuning fork. I'm going to do the Weber and the Rhine test. So what I'm going to do for the Weber is I'm going to strike the tuning fork, make it vibrate. I'm going to place it on the center of your forehead, and you're going to tell me if you hear it in your left ear, your right ear, or both, okay?
I hear it in both.
Perfect. Now we're going to move to the Rhine test. I'm going to do something similar. I'm going to strike the tuning fork again, make it vibrate, place it in your mastoid process. You're going to tell me when you stop feeling it. When you stop feeling it, I'm going to place it next to your ear, and you're going to tell me when you stop hearing it, okay?
Okay. I stopped feeling it.
Okay.
I stopped hearing it.
Awesome. We're going to do the same thing in the other ear, okay?
Okay. I stopped feeling it.
Okay.
I stopped hearing it.
Awesome. So next we're going to move to eyes. This is called the Rosenbaum test, okay? So I'm going to have you do them now. One of your eyes, and then you're going to read the lowest line possible, okay?
Okay.
I'll start whenever you're ready.
I can read the bottom line.
Okay?
4, 2, 6, 7, 3, 9.
Awesome. You can switch eyes now and do the other side.
I can also read the bottom line.
Perfect.
4, 2, 6, 7, 3, 9.
Perfect. Next, I would check for color blindness. And now I'm going to look at your external structures of your eye. I'm going to look at your eyelashes, make sure you have no ptosis or edema, okay? Your sclera is white, your conjunctiva is pink, and your cornea is clear. I'm going to check out your cardinal gaze now, okay? So just follow my finger. And your convergence. Perfect. And can you cover one eye for me? Awesome. I'm just going to look inside your eye, okay? Grab the right eye and switch. Perfect. And then cover your other eye again. And I'm going to hold some numbers up, okay? You're going to tell me what you see.
Okay. 5, 4, 2, 1.
Okay? Other eye.
5, 2, 1, 4.
Okay. Can you look at the picture at the wall over there?
Mm-hmm.
And look at my finger. And look at the picture of the wall. And look at my finger. Perfect. I'm just going to grab my instrument over here. I'm just going to take a peek in your eye, okay? I can see that your pupils are 3 round, equal, and briskly reactive to light, okay? Now I'm going to have you follow the light, okay? And I can see a pinpoint white light in both of your pupils. The next test I'm going to do, then I'm going to look in your eye again with this, okay? And I can see a red glow in both eyes. While I was looking in her eyes, I could see that her veins and arteries were in all 4 quadrants. Her AV ratio was 2 to 3, and cup to disc ratio was 0.8. Okay? So next we're going to move to nose and sinuses, okay? I'm going to start with your sinuses. I'm going to palpate your frontal and maxillary sinuses, and you're going to tell me if you feel any tenderness, okay? Any tenderness?
No.
Okay, I can see that your nose is midline. I'm just going to palpate it. I can't feel any lesions or nodules or edema, okay? I'm just going to look inside of your nose. I can see that there's no deviate septum or turbuncles, and there's no drainage or lesions or nodules. Okay? So next, I'm going to check your mouth and pharynx, okay? I'm going to palpate up here, which is your TMJ, okay? Any tenderness?
No.
And there's no crepitus present. Can you open up your mouth for me? So I can see that your lips are pink, your tongue is pink and moist, your teeth are straight and white. I can see that you have one cavity over there and that you are missing your wisdom teeth. I can see your parotid and sense and ducts. Can you lift your tongue up for me? Perfect. And I can see your wart and stuff. So you can close your mouth for a minute. I'm just gonna grab my flashlight. Can you open your mouth for a second? So I can see your hard palate, your soft palate, and your uvula. Can you say ah for me? Perfect. So there are no lesions or nodules present on your tonsils. Also on the Broski scale, I would say about a 3, okay? And I would also check your gag reflex during this time, okay? So next, I'm gonna move on to your neck. So I'm gonna check your vertebrae gap here. Do you have any tenderness at all?
Nope.
Okay. Can you move your head to the left? Move your head to the right? Can you look up and down? Perfect. And can you do it against resistance for me? Perfect. And this side? Perfect. And can you shrug your shoulders for me? Perfect. So now I'm going to see that your trachea is midline. I'm going to palpate your thyroid gland. I'm also going to palpate your carotids, okay? So I'm going to start with this side. And move to this side. Awesome. I would also take my stethoscope and also take both of your carotids and make sure that you have no bruits, okay? Awesome. So now I'm going to do cardiovascular and respiratory. I would take my stethoscope, I would listen to her heart. I would notice that you have S1 and S2 present. I would also say that there are no murmurs. I would listen to your respiratory. Wise, I would listen to all 4 quadrants, front and back. I'd make sure that it was clear, that air was moving freely inside of your lungs, and that you had no wheezing or anything like that. I'll be back in a few minutes with your paperwork, okay?
Thank you.